she's going first. Oh, and great, thanks for recording. I should be doing that. That's fun. Okay, so I'll say that again. I'm going to be introducing Eyelle Sacher. She was born and raised in Los Angeles, as was I, and she got her undergrad studies from the University of Michigan with her nursing and midwifery education from Emory University in Atlanta, Georgia. And she has been a practicing midwife at UCLA, or nurse midwife at UCLA since 2016. So thanks for joining us, Eyelle. I'm looking forward to your presentation.
Yeah. Thank you. Thank you so much for inviting me. And May, just to give you some background, May asked me to give a presentation on pregnancy for 15 minutes. And so bear with me as I try to present as much material as possible in about—
I think we finally said 20 minutes, right? Like that, yeah.
So here it goes. Let's see if I can figure out my share screen. Okay, so just a few objectives before we get started. We're going to try to get through as much information as possible. And I'm going to talk about what happens during pregnancy, what happens during labor and delivery, and a little bit of expectations postpartum. And then May is going to give a presentation and hopefully answer a lot of how to feel better after pregnancy, during pregnancy, labor and delivery, and postpartum period. And we should have time at the end to answer any questions or anything that we don't get to. So to put everything in perspective about pregnancy, I think it's important just to understand how much your body is going through over 9 months. Your uterus is the main host of your pregnancy, and it will grow up to 5 times its normal size. Most of these changes are happening because of hormone changes. And as it's growing, you can expect different discomforts, different changes, different sensations. And I'm going to talk a little bit about what those feelings might be. So as your pregnancy is progressing, and even if you're finding out that you're pregnant, kind of expectations and what your hormones are doing, usually the key players are progesterone and estrogen, but there's some other players here. In your first trimester, usually just when you're finding out you're pregnant, a lot of women will start to feel nauseous. They'll have some nausea and vomiting. Usually this is those hormone surges as your pregnancy is developing. And then throughout your pregnancy, generally for your first, second, and third trimester, as you're transitioning trimesters, you'll often have a surge in hormones, and that can cause a lot of women to have a headache or a migraine. Women who have a history of maybe a premenstrual migraine or a PMS headache will often get these during their pregnancy. Your progesterone is responsible for a lot of is responsible for keeping your pregnancy healthy and growing, but it also has a lot of other effects. And so it can cause some carpal tunnel because it softens the cartilage on your joint. So a lot of women will have some wrist pain during pregnancy. The other key player is estrogen, and another key hormone that at play is called relaxin. And together, those can cause ligament laxity, which a lot of women will start to feel that their pelvis and their hip bones start to feel a little bit wobbly. And those are those hormones making everything feel kind of loosey-goosey. You also have softening of your connective tissue, and you'll also have worsening of venous return. So a lot of women will get a varicose vein, lower limb varicosities. A lot of people know that as a varicose vein. So you'll get that usually in your lower limbs, but you can also get it in your labia, on your legs, and that's a common complaint. A lot of times too, your body, kind of 2 changes are going on in your third trimester. Your actual diaphragm and thoracic diameter will start to increase. So your rib cage basically goes like this. And as that happens, it makes it very difficult to feel like you can take a really good deep breath. And then you also have a baby pushing up against your lungs. So you'll have a sensation like it's hard to get a good breath. And then the progesterone, again, will cause a lot of constipation, and a lot of women will start to experience heartburn. So what can we do about that before going to see a physical therapist, or things that you can talk with your OB provider about? For nausea and vomiting, often you just want to make sure your stomach is never empty. You want to continue to snack frequently. Sometimes ginger or lemon flavors will do well. So you can take ginger candies or ginger tea. Sometimes lemon water, or you can make like a lemon ice cube. Sometimes that can help with nausea. You want to try to avoid having an overfull sensation. So just making sure that you're constantly snacking, but you're never fully stuffing yourself. And a thing that can be really helpful is to space out your liquids from your solids. So if you need to be staying hydrated during pregnancy, but you'll often feel really nauseous if you drink a whole water bottle and eat your entire lunch at the same time. So if you can slowly sip on liquids throughout the day, waiting an hour before meals and after meals, that will help a lot with that sensation. You also just have to play around and get creative. So some women do much better with carbonated beverages. Sometimes you have to do still liquids. So just see what works better on your stomach. And then other remedies you can take over the counter, those C bands for motion sickness. And then you can also buy vitamin B6 and Unisom, and those are kind of over the counter. If your nausea and vomiting is worse and you find that nothing is helping, talk to your provider, because there's other things that we can prescribe for you. Another, common side effect that someone will feel is that carpal tunnel or that wrist pain. I, as a midwife, almost always refer to physical therapy because our OB appointments that we have together are just not long enough to go over everything. And the physical therapist will really be able to go over that. And May, I think, is talking about that. But in general, you want to maintain a good wrist posture. So sometimes you want to make sure that you're not falling asleep with your wrist bent like this. I know I'm guilty of this because it's a comforting position, but you want to make sure your wrists are staying really neutral. Sometimes wearing a wristband can help. And then and kind of avoid texting, because this movement of your thumb is also bad for your wrist. With your pelvic pain and hip pain, and sometimes women will get a sciatica pain or back pain. Again, I refer to physical therapy, but a couple things you can do before that. We work really well with complementary therapies. So what I mean by that is going to a chiropractor or an acupuncturist, because we're all healthcare providers wanting to make you feel better. So those are really good people to go to. And then trying to maintain a good posture while you're walking and upright and sitting at your desk. Sometimes what's really helpful is to actually swap out your office chair for a birth ball, also known as a stability ball, and you can get a chair for your office made out of a birth ball instead, and that helps keep your hips open and helps focus on your posture. And you want to make sure that you're having good hip posture. You're keeping your hips nice and stable overnight. So sleeping with a pillow between your legs is often very helpful. And then something called a pregnancy support belt, or SI joint belt, something like that. It's just an extra support around your hips to help lift up your belly and your stomach. For headaches and migraines, often Tylenol is going to be what we say. Sometimes a sip of coffee can also help, and an acupuncturist can also really help with some of that headache, because sometimes it's related to neck tension, and going to an acupuncturist will relieve some of that tension. So what I'm trying to say is we're a group team here. We work together. Other things that you'll experience, and some more remedies, if you're starting to notice some lower limb varicosities, you want to make sure you're wearing compression stockings, making sure you have good footwear, keeping your high heels locked away, and making sure you're wearing a good sneaker. And then you want to keep your blood flow moving. So doing some exercises and stretching for your lower limbs is going to be important. Constipation, first and foremost, is going to be staying hydrated, making sure you're getting enough to drink. If you want an actual ounce amount, ask your healthcare provider. They can kind of help walk you through that. Making sure you're eating well, so going through your diet, adding in fiber, good fibrous foods, and then you can take medication as needed. Often we'll say start with a stool softener like a Colace, and then add in a bulk fiber supplement like Metamucil, and then as needed, you can add in some Miralax. And then for heartburn, depends on how often it's happening. Is there a pattern associated with it? If you're going to get heartburn, if you're not pregnant because you're eating spicy takeout and you're pregnant, it's just going to be that much more exacerbated. So try to avoid those trigger foods like spicy and fried foods. You can take Tums as needed. And if Tums aren't working, then you can go ahead and bump it up to Pepcid. So those are all things that are happening during your pregnancy. We are preparing for labor the entire time that you are pregnant. The end goal really is having a baby and preparing for labor and delivery. So throughout pregnancy, you want to be making sure that you're staying healthy and you're preparing for the main event. I've never run a marathon before, but people say it's like preparing and training for a marathon. And you want to make sure that you're an informed participant for your labor. So you want to make sure you're being an active participant in your healthcare, that you're taking childbirth education classes, you're reading up on what it's like to give birth, you're preparing with your partner, kind of what to expect around your house or your apartment, what you're going to need. You also want to make sure that you're staying healthy throughout your pregnancy. Exercise is really important while you're pregnant. If you're not sure what safe specific exercise is, I would reach out to your OB, either your midwife or your physician, and find out specifically what's okay for you, because certain exercises might be better for some women or others. But we definitely want you to stay active through your pregnancy. It's good for your blood flow to your baby. It's good for your own mental health. And it's good because it helps you prepare for labor. It's also good because it helps maintain weight control during your pregnancy. In general, we want you to gain weight during your pregnancy, but we want it to be a healthy weight gain. And most of the time, it's a range for the average woman. And we know that every woman is a little bit different. So it's usually a range that we say. In general, for the healthy women with a healthy BMI before getting pregnant, it's about 25 to 35 pounds. Sometimes it's, maybe 11 to 20 pounds, maybe it's closer to 40 pounds. And that's a question I would ask your healthcare provider. What's an ideal weight gain for me and my baby? And then just remember that every woman is a little bit different. But weight gain is important because if you end up gaining too much weight, it's going to be harder to labor. And if you don't gain enough weight, there's risks associated with baby. So just talk to your provider about that. And then I think most importantly is no matter how much you plan for labor, it's not going to go according to plan. So try to just keep that in mind and be flexible, and that your baby is a little bit the boss for your labor and delivery experience. So in terms of what's actually happening in labor, I really like this picture. I took it from Bundle Birth. Bundle Birth is a great organization. It was started by a labor and delivery nurse here in LA at Cedars, and she has great resources. So small plug for her. But this kind of gives you a sense of what your body is going through when you are approaching labor, kind of the last couple of weeks of your pregnancy. You see that the baby has engaged into the pelvis, and you can kind of imagine that bone on bone, that baby's head against the pelvic bones, is probably not the most pleasant sensation. So having some hip discomfort, some back pain, kind of to be expected at the end of pregnancy. So what's actually happening when you're in labor? Very briefly, labor is contractions that cause cervical change. Your cervix is the opening of your uterus, and it connects your uterus to the vaginal wall here. So when you're having contractions, your cervix is thinning out, which is called effacement, and it's dilating, which means it's opening up. And baby has to move down through the pelvic bones, through the vaginal wall, and then out of the vagina. And this is just a nice little picture of what actually is happening here. And to get baby to open up your cervix is your contractions. And then to get baby from inside to outside is you pushing your baby out for a vaginal delivery. I'm going to share a little video. It's about a minute. I just have to figure out how to put my YouTube on here, because it gives a good visualization of what happens when you're actually pushing out your baby. And I'm going to pause right here and point out this white is a bone, and this is your bladder, and your baby is going to be moving through this. Okay, so you can see all of those movements that that baby has to do to get out, and how much pushing is required to get that baby out, and some of those landmarks, because that's important for what to expect postpartum. In terms of how to help baby come out, there's a lot of, I would say, kind of current talk about pushing and positions for pushing. A lot of it depends on you as the mom. A lot of it depends on baby and their position. And a lot of it depends on your energy level and medication on board. So the baby has to descend through the birth canal. It takes a while for a baby to fit through the birth canal, especially if it's a first time pushing a baby out, if it's your first baby. It can take usually 1 to 3 hours, but not crazy if it takes 4 hours. You want to work with your body. So as your body is contracting, that's when you want to use that muscle to push the baby. And if you have an epidural, you may or may not be aware. It kind of depends on the person. And usually your nurse or your midwife or doctor are going to be helping coaching you. And the best position to push is the position that gets baby out. These are just a couple examples of positions that help baby come out. Often gravity is really helpful. So you can see a lot of these positions, the woman is in upright position because gravity is going to help push that baby out. In general, you want to have a squat-like position, as though you were stuck in the woods and you had to pee in the woods. That's sort of the position we're mimicking. So your hips are open. Often you're curled over your baby. And then you kind of just rotate between, whether you're squatting or you're on your side, your hips can stay open. If you're on your back, your hips can stay open. You can be sitting kind of upright. You can be leaning forward on a hands and knees type of position. And these are all great positions, but ultimately you want to just push your baby out. And so that's where a good nurse or midwife or physician, they're going to talk you through what's working best for you in that moment. And sometimes you need to go through all of these to push your baby out to find the movement that works best for you. And that's okay. Side lying is often a great position because you get the comfort of lying in between pushing, but you're able to keep your hips open a little bit more, and it's a little bit less intense on your hips, and you tend to be a little bit less sore the next day. But it is hard work. So just remember that labor is called labor for a reason, because you are working hard to get this baby out. So assuming you're pushing well, you'll have a delivery. Often it's going to be a vaginal delivery, but about a third of women in our country will end up with a cesarean section, and that comes with its own recovery period that I'm not going to talk too much about today, just because I just don't have time. So assuming you have a vaginal delivery, kind of what to expect afterwards. So most of the time, women are going to have a laceration, which is a fancy word for a tear, and you'll need some stitches. These are typically done immediately after the birth. You'll be numb, and it's usually in the perineal muscle. right afterwards, you saw in that video, that baby is pushing against your bladder. And so it's very common to have some urinary weakness and incontinence immediately after birth, and sometimes lasting for weeks or months or even years. And May is going to talk about that. Those muscles just pushed out a baby. So it's normal for your pelvic floor to be a little bit weak immediately after delivery. Usually the first 2 days in the hospital, you'll almost feel like, what happened to my vagina? And that's okay. It's normal to feel like that. Usually by the time you go home from the hospital, things will start to feel a little bit more in control. And then you were laboring in someone else's bed. Usually it's at the hospital. So often you'll have some back pain. Your breasts are going through some changes because your milk is coming in. If you want to breastfeed, which I think a lot of people do, and it's a little plug for breastfeeding, your breasts are going through major changes as well. They're filling up and filling with milk. And then your hormones go through a big change. So in the pregnancy period, your estrogen and progesterone were very high to promote a pregnancy, and immediately after they drop in order for breastfeeding to kick in. And as that hormone shift happens, you'll feel a little bit hormonal and a little bit emotional, and that's okay. And then just kind of briefly, if you ended up in a cesarean section, it's major abdominal surgery and it takes a while to recover. And you probably are going to need some physical therapy because it is surgery and you want to strengthen those muscles after surgery. In general, just a couple more changes. Because of that hormone shift, you'll have some vaginal tissue changes. Usually we see this at about the 6-week postpartum visit. So it's normal for your vaginal tissue to feel dry and sensitive. You'll sometimes feel residual pelvic floor weakness. You'll often get a clogged duct as you're navigating breastfeeding and maybe returning to work or being able to go back to a grocery store and not breastfeeding on demand. So you'll often notice some clogged ducts. A lot of women will end up with what's called mommy wrist because you're constantly breastfeeding and you're probably not having the best posture the whole time. You're also probably pushing a stroller and you want to make sure that your wrists are in an appropriate position, but often you'll get some mommy wrist. And then some abdominal weakness, which again, I'm going to defer to May to talk about that because I saw that in her slide. And then just some postpartum support. It's really important to get support because postpartum is a challenging time for a lot of women. So having support groups, going to your OB provider, asking for help. If you feel like something's not right, ask for help. We can't read your mind. So whether it's your midwife, your doctor, a doula, your family member, being able to ask for help is really important. Often you'll need this sort of group team approach. So you might need physical therapy for yourself. You might need occupational therapy to help with baby's positioning. You might need lactation because you're working on breastfeeding. You might need to consult with a sleep specialist if you're worried about newborn sleep patterns. And very common is postpartum depression. So don't feel like you're afraid to ask for mental health because it is really important to be able to be supported. And then I think we decided we're going to talk about questions at the end, and I'm going to turn it over to May. So that was my pregnancy presentation in, I think, 20 minutes.
Awesome, Eyelle. Yeah. Thank you so much. That was really fascinating. And as a physical therapist, so while we make this transition, of course, I'm going to ask everybody to kind of stretch a little bit, because you sat through one presentation. So again, if you can do some shoulder rolls here, some butterfly opening, closing, if you can stand and move around a little bit while I load my slides. So basically, as a physical therapist who specializes in treating the pregnancy and postpartum population, I'm going to talk about the most common things we can see and also what we can do about it. And I don't want to do this with fear. I don't want anybody to think, oh my God, this is so scary. Why am I pregnant? Why did I get pregnant? If anything, I want you to see how common these conditions are and that it's okay to talk about it because sometimes we're embarrassed or we don't know how to talk about this, and know that this is something that we as pelvic floor PTs here at Rehab Specialists talk about all day long. So again, I will talk about everything. And again, if this is new stuff to you and you're like, oh, this didn't happen to me, then that's great. But if it did happen to you, that's fine too. And then just know that you can get help for it. So we're going to begin. Hopefully everybody's all stretched out now. So this is physical therapy for pregnancy and postpartum conditions. Again, we're going to go over some of the common conditions we see in physical therapy during the pregnancy and postpartum period. And I will just say, I tend to talk fast when I get excited. So if anybody's like cannot understand me, please just like unmute yourself and let me know. But we, again, as Eyelle pointed out, we do see a lot of musculoskeletal pain. So this can include low back pain, PGP, which is pelvic girdle pain, SI joint pain, symphysis pubic dysfunction, and coccyx or tailbone pain. It's also common to see incontinence, as she mentioned as well. So I'm going to talk a little bit about both urinary and fecal incontinence. Pelvic organ prolapse, carpal tunnel, of course, she mentioned for the wrist. Diastasis recti, which is that separation of the abdominals. Clogged ducts, pain with sex, and then of course we'll talk about how we can help. Again, remember, this is just for general guidance, and so always please seek advice from your medical professional before starting PT or any exercise program. So first we'll talk about musculoskeletal pain we see. Low back pain, of course, very, very common. Even in the non-pregnancy and postpartum population, about 80% of Americans will get low back pain at some point in your life. Again, it's estimated about 50% will have low back pain during pregnancy and postpartum, and it's actually the most common cause of sick leave after delivery. Of course, some of the reasons can be the weight gain, your center of gravity shifting, stretching of those abdominal muscles, and the hormonal changes. Also, I would argue if you already have children and you're running after them and lifting young kids as well, that's a lot of lifting on this changing center of gravity. Now to get to more specific types of pain, PGP stands for pelvic girdle pain, and they kind of use that as an umbrella term now to mean anywhere in this pelvic area. So anywhere in, it can include the sacrum area, it can include the pubic symphysis as well. So any pain in that region. The SI joint specifically means the back where the sacrum is. So a lot of people think of this as low back pain, but often it sits even lower than that. Symphysis pubis dysfunction happens in the front. So your pubic symphysis is usually really strong, and there's a lot of fibrocartilage there. During pregnancy, of course, the joint gets more lax to make room for baby. And so some people can have problems there as well. You'll see it, well, we'll talk about it in the next slide too. And then finally, coccyx or tailbone pain, which will be in the back. And a lot of times it's described as pain with sitting or even leaning back on that joint too. And we can see any of this really during pregnancy or afterwards too. Another one that we see is round ligament pain. So this usually happens in the second trimester, and it's because this round ligament, you have two of them. It attaches from the pubic bone to the uterus. And of course, during pregnancy, as the uterus is growing, the round ligament is stretching as well. So it can feel achy or crampy, but we also see sharp and stabbing pain. And it usually happens with changing positions, which I should have pointed out. The same thing with pelvic girdle pain. So both of these can kind of mimic each other. It's that shifting, bed rolling, getting out of a car, anytime where you're using one leg versus the other, that's when we tend to think round ligament or pelvic girdle or pubic symphysis dysfunction. And for whatever reason, the round ligament is usually felt on the right side, even though you can get it on the left side too. So how can physical therapy, or how can you treat this to help yourself too? One of the big things we do is look at your whole posture and body mechanics. So of course, during pregnancy, the weight is shifting forward. So usually people tend to tip back and extend back for that, and then round the shoulders forward. So that's putting excess pressure on the lower back while you're locking your knees out as well. So we try to help get that rib cage over the pelvis. I don't really like the idea of tucking the tailbone, but again, kind of lowering so you're not so extended. Again, we can look at manual therapy. So there are mobilizations we can do for the tailbone, for the pelvic girdle, and for your pelvic joints in general, as well as manual work to the lower back or any area that feels restricted. Of course, we're going to watch you do safe exercises because, as Eyelle pointed out, too, super important to stay active during your pregnancy so we can give you stuff to help stabilize that pelvis. Aquatic therapy is great. A lot of my mamas love aquatic therapy because especially during pregnancy, it takes away about 80% of your body weight. So you can do a lot of exercises in the water. And we do have 2 pools at our office as well. We can look at other supports too, so including braces, pillows for sleeping, and we can also do kinesiotape techniques. And if you don't know what that is, I'll show you in the next slide. So these are some sample treatments that we do or that you can do for yourself as well. This is a way that I like to tape the belly for the round ligament. It helps to offload the belly and support. So it's giving you the support that that round ligament may not be giving anymore because it's stretched. I like this pregnancy. And again, I'm not trying to advertise any specific product. These are just samples of ones that we tend to use in the clinic or that I like. So again, this is like a pregnancy wedge. A lot of people use that body pillow, but I like this better because oftentimes the body pillow doesn't actually offload the belly when you're sleeping, but definitely sleeping with something in between your knees and then this to help offload your belly so it doesn't rotate your spine at night is helpful too. Squats are a great exercise. In the later stages of pregnancy, they'll help prepare your body for giving birth, as Eyelle showed the birth positions too, but it also helps to strengthen the glutes and the core. Clamshells, they found that if you strengthen your glute med, which is kind of the side glute, that really helps with a lot of the pelvic girdle pain and SI joint pain. Again, in terms of other supports, these are companies that we like that help to support, again, just give you a little something extra since your body is changing. So Belly Bandit makes a really great band and it actually has a V split below. So this actually can help with any of the varicoceles or the swelling during pregnancy. And then the band helps to support the SI joint and pelvic girdle. Sorolla is the same thing. They have a band that goes around and you can wear this while you're sleeping too, which is great because a lot of times that rolling over is where a lot of the pain comes from. And then you can also see supports like compression that just offload the belly itself. And you can use that as well for round ligament pain or also just to help support a heavier belly. Other pain we see, this is not so much during pregnancy, but in the postpartum period is pain during sex. So again, many people are cleared for any activity, usually go to your OB and they give you that 6 weeks all clear to do anything. But again, remember that that doesn't mean you're ready for everything too. There's also a lot of psychosocial and emotional issues that go into sex after pregnancy as well. But some common physical reasons that we see in physical therapy that you can have pain during sex include the vaginal dryness due to the low estrogen, because especially if you are breastfeeding, you will have low estrogen during this time. And the vaginal tissue really responds to estrogen. So definitely want to remain lubricated. Breastfeeding for the same reason that I just pointed out. And it also affects other hormone levels that may change libido. So they found that prolactin, which helps with milk production, can also decrease sexual arousal at that time. Again, if you have scars that are still healing, either C-section scars or again, if you had any of the vaginal tearing, that can also maybe need to be worked out. It may still sting a little bit or not feel comfortable. And interestingly enough, pelvic floor muscle tightness. So oftentimes we think after giving birth that the muscles are just lax and loose, but sometimes the muscles are guarded, especially if you have the scars that are healing or tissue that's still healing. So again, how can we help as physical therapists or how can you help yourself too? In physical therapy, we will actually assess the pelvic floor muscles. So we will do an internal exam, looking at any scar tissue, looking to see how your muscles are moving and looking to see if there is tightness or vaginal dryness. We can do scar tissue massage or show you how to do it on yourself, which is what that picture is down here below. It's also nice to do a perineal massage sometimes before giving birth. Usually there hasn't been good research on it that shows that it definitely helps to prevent tearing, but it can't hurt. Lubrication, super important. So there's different types of lube and I could give a whole presentation just on that alone. But you know, it's kind of what we like to do. So some people like more of the oily lubes like argan oil, vitamin E, or coconut oil. There's also brands like Good Clean Love here, which is more aloe vera based. And as we know, aloe is great for soothing tissue. And even home exercises. So if this means using a dilator kit to help stretch the tissue again or stretch the scar tissue, we can go over all of that with you. Okay, moving on to incontinence. Again, when we talk about urinary incontinence, there's mainly two types that we see with pregnancy and postpartum. So one is called urge urinary incontinence, and that is when you're losing urine when you have the urge to go. So that's people who have to go to the bathroom. They're running to the bathroom every hour. Again, totally normal in your last trimester, but this is like when it becomes a problem when it continues onwards. You may find yourself sitting at the end of an aisle because you know that you want to get up to go several times and you don't want to bug anybody. That's what we consider urge incontinence. Stress is when you lose urine with laughing, coughing, sneezing, jumping. A lot of my patients are like, I was jumping on the trampoline with my kid and I'm never going to do that again. So that would be stress incontinence. And then there's mixed, which is a combination of the two. And again, I just like this diagram. It kind of shows what's happening with the bladder. Again, don't worry about overflow. That's actually more of a male issue. But with stress, again, oftentimes it means the pelvic floor is weaker. And then the pressure from above makes the bladder leak and the muscles aren't strong enough. Or again, we can get urge incontinence where again, either from the nerves being overactive or again, even from tighter pelvic floor muscles, I would say too, you may feel that urge to go and can't hold it. So again, I want to point out how common this is because a lot of people are super embarrassed to talk about it or feel like they're all alone. But over 33 million Americans, this is pregnant, not necessarily pregnancy related, have been affected by some type of urinary incontinence. With pregnancy related, in the last trimester, about half of prima pairs have urinary incontinence, and that means somebody who's giving birth for their first time. 85% of women who have given birth multiple times have it. Postpartum, 92% of those incontinent at 12 weeks were still incontinent at 5 years. And again, it's not, a stretch to see why. Here's what your body looks like not being pregnant. There's the bladder at the bottom and the intestines. When you are pregnant, you can see how everything kind of makes room for the baby, including the bladder getting kind of pressed down below. So it makes sense that there's just a lot more pressure on that bladder. Now I'm going to talk about fecal incontinence, which is the unexpected loss of bowels or also gas. And again, if urinary incontinence is embarrassing to talk about, this is like really not talked about. But again, we do see it here. The frequency can actually be 2 to 6%, and it increases to about 25% if you include gas. The risk factors, of course, are a 3rd or 4th degree tear during birth or a forceps delivery. And I liked this picture. It kind of shows the different types of tears that you can get during childbirth. Again, the 1st degree is just when the skin is torn, but you can see in the 3rd and 4th degree, if it goes down to the anal sphincter or rectum, you can see why there might be some fecal incontinence after that as well. So how can PT or how can you help with incontinence? Definitely you want to look at your diet and water. So again, yes, regulating bowels is super, super important. Again, in terms of diet, we can discuss it with you up to a point in terms of fiber, but really, again, if there's a big issue going on, I definitely recommend talking to a registered dietitian or nutritionist. Bladder retraining and delay techniques. If you are somebody who has more of that urge where you're running to the bathroom, we can help you kind of reduce that urge. Again, we are going to do that pelvic floor muscle evaluation where we check, we see how strong you're contracting. Can you release? Is there any pain in those muscles? And of course, looking at pelvic floor and core muscle training as well to get everything working together. A big part of it is regulating pressure. So again, if there's pressure downwards and the pelvic floor muscles cannot sustain it, that's when we can see leaking. So again, a lot of people ask, well, isn't that just Kegels? Like, shouldn't we just do our Kegels and be fine? Not necessarily. While they have been shown to be helpful, again, when women are just told to do Kegels, they found about 25 to 40% will do them incorrectly. And again, sometimes they may be contraindicated. Like I talked about, if the muscles are too tight, you actually don't want to be Kegling because then you're just tightening a shortened muscle. So that is why I definitely recommend getting treatment, seeking out a pelvic floor PT to see if you actually need to do them or if you're even doing them correctly. These are other fun devices that are out right now. I mean, it's a great time to have these issues if you have them because there are so many other things you can do at home. These are some biofeedback devices that also provide some stims. So this Attain actually helps with fecal incontinence, urinary urge, and stress urinary incontinence, and it is covered by Medicare. But there's also other fun ones like the PeriFit, where again, this probe would go internally and there's an app on your phone and you like play games with your pelvic floor muscles. So you can like Kegel and see it like contract and release on screen. There's also the KFit Kegel toner, which works for men and women as well. Moving on to prolapse. So prolapse again is when, again, one of the organs is sitting a little bit lower than it used to sit. So that might be your bladder, your urethra, your uterus, or the rectum. And again, you can get low back pain with this. So that's why, again, if you have low back pain, always good to actually check out the pelvic floor too. But the biggest symptom I hear is the feeling of heaviness or pressure. So women will literally say, I feel like something is falling out of my body. And that usually sets off the alert of prolapse in my head. Of course, childbirth, multiple births, larger babies, and chronic constipation, because again, anything pressing downwards can lead to these issues. And up to 4 in 10 women will have a pelvic organ prolapse during their lifetime. So again, pretty big part of the society. Again, how can we help? I don't know if you've seen like the squatty potty or stools like that, but it is actually a great way to help actually go to the bathroom. And that helps to relax the pelvic floor muscles, helps to decrease pushing downwards. So really anything that we can do to help decrease pushing downwards. Again, we're going to talk about bowel and bladder habits. Also, posture is a really big one. So if you're somebody who's rounded forward a lot, that actually they have shown puts more stress on the pelvic floor as well. So posture is super important. These are other supports. Again, great time to be alive if we have these issues. So there's ones that are actually supports from below, like the V2 supporter or the braceability. And they actually wrap around and they add some compression. So I know some people on here are lymphedema therapists too, or work with lymphedema. And these actually can help with lymphedema of the pelvic region, but they also help to support and compress from above. So they're giving you that extra help. They also have these EVV sport shorts right now, which kind of do the same thing. So they support from the ground up. If it's a really bad prolapse, you can even use a pessary or something like this, but you will need to be fitted by your gynecologist or urogynecologist. And that actually helps to support internally. Okay, diastasis recti. So this is a big topic. There is some controversy going on with it right now too. I unfortunately feel that we've scared a lot of women with diastasis to say, oh my God, you have this gap, you need to close this. There's different types of diastasis. That is when the center line of the abdomen pretty much splits, and it can be lower, it can be kind of around the belly button, higher than the belly button, or all the way through. But you'll see in the upcoming slides, it's not just a split in the center, there's other things going on as well. So again, the risk factors are if you are giving birth over 33 years old, multiple births or multiple gestations, a larger baby, greater weight gain, or a C-section. 66% of women will have at least one support-related pelvic floor dysfunction. So again, if you're just like, oh, it's just my abdomen, remember there may be other things going on below too. Now, how many people have this? It's hard to tell. They do say 100% of women have it in the 3rd trimester, which is totally normal at that time, but I've seen other numbers too. And 53% of women will have it immediately postpartum. And again, remember, it's not just the linea alba or that center line, but the whole wall. I wanted to put this picture on here as well. This is a man, if you can't tell, and men get this as well. And it's not as talked about with them. And I think it should be, because I don't know why there's so much stress on women getting it when we don't talk about men getting it too. So again, a lot of times you'll see men more with the beer bellies or beer guts, and they're doing sit-ups, and it's almost like this tenting happening. So know that they also have to watch that as well. So again, there's different treatments you can do for this. Again, a lot of times it closes up on its own postpartum, but there's things we can do to help. So that includes this kinesio tape method to help tape the center, or again, wearing an abdominal binder can sometimes help as well. Corrective exercises. So again, there are some exercises where if you do have the diastasis, you probably want to avoid. Sit-ups are a big one. Anything that can kind of lead to that pressure through that region, we kind of want to avoid that at first too. As PTs, we also do manual work for the abdominal fascia and the C-section scar to help bring the fascia back together or mobilize the C-section scar. Again, looking at posture and body mechanics. How are you lifting your baby? Are you crunching up out of bed? Are you doing stuff where it creates that pressure through that region? And we used to just test it by how many fingers the diastasis was separated. So it'd be like, oh, I really want to get back to 2 fingers or 1 finger. But what we've seen now is that it's more important to generate tension through the linea alba versus necessarily closing that gap. So one of the biggest things we start with is just diaphragmatic breathing. This is a great way to regulate pressure through your body. And again, it's where you inhale into that belly, which again, a lot of people are afraid to do if they have the diastasis, but it's actually the way to start. This helps move the pelvic floor and the abs correctly. But know that there are other ways to help too. Like I mentioned with posture, A lot of times in the mommy posture, your stomach is still sticking out and the rib cage is back and flared. So we help to get you back to the correct positioning. There's also, if you don't like regular abdominal binders, there's someone called Belly Bind, which is located in Los Angeles, and they do more of the Malaysian style binding for the stomach too. And again, some techniques to avoid, just be mindful of when you're extending too much or arching, and again, just sticking out that diastasis. As Eyelle mentioned, a carpal tunnel super common during pregnancy. It affects about 31 to 62% of pregnant patients. Again, numbers aren't great in pregnancy and postpartum research. I feel it's like all over the map, depending on who you ask. But again, you'll experience the numbness and tingling in the first 3 digits of your hand. So that's important because a lot of people think any pain in their hands is carpal tunnel, but it's really along what we call that median nerve distribution. And of course, it's because of there's more blood volume at this time, more swelling. The wrist is a small space. So again, that can entrap the nerve. This is where not just PTs, but somebody called an OT or an occupational therapist can also help. Definitely that wrist brace at nighttime is really good because it does get rid of that flex positioning, or during the day if you're typing too and you're on a computer. There's nerve guides you can do, and again, looking at the whole posture. So oftentimes it may not be coming just from the wrist, but from the neck and the shoulder. So how are you carrying your baby? How are you pushing the stroller? All of that can affect this as well. Clogged ducts, as she mentioned, or plug ducts, sometimes it's been called. And again, so this is after, obviously, for postpartum care. If you get clogged ducts and you're somebody who gets a lot of them, I always do recommend, of course, seeing a lactation consultant too, trying self-massage and a warm compress as well. The issue is that it can turn into something called mastitis, which is an infection, and you would need to see your MD. Usually they recommend antibiotics for that. But we can actually help too as physical therapists. We do ultrasound assisted massage to the region. So if you're somebody where that clogged duct is just not going away, or again, you just get a lot of them, we can actually help to do ultrasound, which is a deep heat to the tissue, and then do massage as well to help get you to expel them. So the takeaway and summary of this is, again, just because these symptoms, which are either the pain, the leaking, diastasis, etc., are common during this time, it doesn't mean you just have to deal with it. So again, a lot of times it'd be like, oh yeah, I'm having this leaking after pregnancy. I'll just wear a pad for the rest of my life, and know that you don't have to do that. And treatment consists, I hope as you saw from the slides, are doing so much more than just the Kegel. So a lot of people think they're going to come to pelvic floor PT and we're just going to teach you how to Kegel. But again, please know we look at the whole body. We can assist in so many ways, and that we are here to help during and after pregnancy. And as Eyelle mentioned too, it is a team effort. So again, we refer back to OBs, back to acupuncturists, chiros as well, lactation consultants. So we're all here to help you. Okay, and that was me. Hopefully I finished under the gun as well. I know a lot. And then yeah, if you have any questions or want to reach me for more, if you don't want to ask the questions here, please find, this is my email address. This is our office phone number and website. And yeah, what questions do you guys have? Okay, thank you. You're welcome. We'll take thanks too. We'll take praise. That's okay.
Well, maybe that was great. I learned so much too, and I work in this field.
Thanks, Eyelle. Yeah. Were we just so thorough that there's no questions then? That's okay too. Oh, we can stop recording too right now for that.